Hi, welcome back to my YouTube channel. In today's video, we will be discussing plantar fasciitis. We're going to talk about what plantar fasciitis is, what are some options that you can try at home to see if you can make it better, and finally, most importantly, when it's time to call your doctor for plantar fasciitis. All right, let's get started with this video. All right, so to start with, plantar fasciitis is an inflammation of the muscles and tissues in your foot, or something called the plantar fascia. It's a band of tissue that originates on your heel bone and fans out to the toes through the arch of your foot. Many people used to think plantar fasciitis were called heel spurs, and in fact, they used to be called heel spurs. Probably 20 to 30 years ago, the condition was known as heel spur syndrome. And we used to think that these small heel spurs that grow off the bottom of the heel bone were causing the problem. But actually, it's the inflammation of the plantar fascia, or even those small muscles that originate with the plantar fascia on the bottom of your foot. Some of the symptoms that you'll find with plantar fasciitis are waking up. Those first few steps that you take out of the bed in the morning when you first wake up, you'll see sharp pain in your heel that radiates out to your arch. And this pain may last for maybe 5 or 10 minutes, or sometimes even longer. And then as you walk around more and loosen those tissues up, it starts to subside. And we call this condition post-static dyskinesia. So it can be when you first wake up in the morning. It can be if you've been sitting down and then you go to stand up, or if you've been driving in your car for long periods of time and then you get out of your car, those first few steps causes traumatic pain to your heel. Some patients even think it feels like a dagger or a nail is stuck in the bottom of their foot. And I've even had patients go to the ER because they were in such pain that they thought they broke their heel. So what are some things that you can do at home? Well, to start with, stretching exercises is the most important thing you can do for plantar fasciitis. When we stretch the calf muscle, or the muscle that's on the back of our leg, this can loosen up the ankle joint, and it'll provide more range of motion to the ankle joint, which can take the stress and tenderness off the plantar fascia. So by simply stretching the calf muscle, you can help improve the pain. Taking anti-inflammatories, if your stomach will allow, or if medically you're able to take an anti-inflammatory medication. These are commonly referred to as NSAIDs, which stands for a non-steroidal anti-inflammatory drug. And these are Advil, which is ibuprofen, Aleve, which is also known as naproxen or naproxen. You don't want to take Tylenol. Although Tylenol can help with the pain, it's not an anti-inflammatory. Tylenol will kill the pain, but medications like ibuprofen and the anti-inflammatories will break up that inflammatory process and help to make the heel pain feel better. Do not soak your foot in water. Do not use a heating pad or any type of hot water or soaking your foot in hot water for this problem, because heat will bring on more inflammation. You're not going to want to hear this, but what you want to do is put ice on your heel. And the proper way to use ice is to use it for about 15 to 20 minutes. It's going to hurt and sting and burn at first, but if you can get past those first 7 to 10 minutes, it'll become therapeutic. And it'll actually be numb, and you probably won't even feel it after those first 7 to 10 minutes. And that will actually be therapeutic at breaking up the inflammation that's occurring. You also want to wear some comfortable shoes around the house, as this can take the stress off of your plantar fascia. You may want to get a pair of house slippers or house shoes to always wear. And while many people think arch supports are important for plantar fasciitis, they can be, but they can also be a band-aid for this problem. We actually want to strengthen our feet and make the muscles stronger so that when we're walking around, those muscles will take over and make our foot stronger. So you can try using some over-the-counter inserts, but it's not a guarantee that an orthotic device or a shoe insert will fix the problem. You may also heard of night splints or socks that you can wear to stretch the foot or provide that calf stretch that we were talking about, and these are great to use as well. You can sleep in these or even just wear them for an hour before you go to bed to try to get a long stretch for that calf muscle. So finally, when is it time to call the doctor? As always, this is the most important part of my videos. You want to call your doctor when this condition hasn't been responding. Some of the treatment options that I mentioned before should start to work after about 2 to 4 weeks, and sometimes even 6 weeks after you've initiated them. If those aren't working, it's probably a good time to see the doctor. What can the doctor do, or what does a podiatrist do for these cases? If you've exhausted stretching exercises and anti-inflammatories and a lot of these things we discussed previously, the next step is a cortisone injection. And even though you may have heard cortisone injections are harmful, they're actually safe if they're used properly. We can give you up to a series of 3 of these where we'll inject the heel, see you back in maybe 3 weeks, 4 weeks. If it's not better, we can give a second one. And the analogy that I use is it's like your heel is on fire and we're using these injections as buckets of water to put out this fire. Sometimes 1 bucket of water can put it out, and sometimes you need a couple buckets of water to get the fire out. If injections fail, which probably 90 to 95% of the time they'll fix the problem, the next step could be surgical intervention. And you don't have to do surgery, but again, this isn't a problem that you should live with. Many times this can be completely fixed. So if the injection fails, the next step is to surgically release the plantar fascia. And this is where we'll go in, and now I do this endoscopically, where we use a small camera to go in through one side of the heel, and we enter the other side of the heel with a small blade, and we surgically release the plantar fascia that reduces the tension which was causing the pain. This is a very simple procedure. It takes about 5 to 7 minutes to do, although it is done in the operating room at a hospital. Recovery time is anywhere from a few days to up to 3 weeks as you're recovering from the procedure, but many patients go on and go back to work much faster than they did when we used to do these procedures open. So to review, remember, you want to try your stretching exercises at home, take some anti-inflammatories if your doctor allows you to do this, wear some comfortable shoes around the house. When this fails, it's time to call the doctor. So as always, thanks for stopping by my channel. Make sure to hit the like and subscribe button to see more videos that I'll be releasing in the future. If there's anything you want to see, leave it in the comments section below. Or if you have any questions about plantar fasciitis or other conditions, make sure to drop me a comment. And make sure to stay tuned for my next video in which I'll be discussing bunion deformities. Thanks, and we'll see you soon.